right. Well, good afternoon, everyone. Thank you for joining today's webinar. This is Jennifer Whitener. I am the benefits manager here for Larimer County. Happy to have you all here today. As a reminder, this presentation is being recorded and we will post it out on our benefits page after this webinar session, so folks can listen to it later if they weren't able to attend it today, or if you want to share that link with any of your coworkers. So we're excited today because we are going to be changing our prescription benefit manager for next year. Currently, we are with OptumRx, and we are going to be moving over to CVS Caremark as of January 1st. So we thought this would be a good opportunity to have CVS present to you just some general information today about the website and resources that you're going to have available to you to manage your prescription drug benefits. And then we'll be able to do Q&A at the end of our session today. So with that, I'd like to introduce Chris Anderson. Chris is our account executive who's assigned to Larimer County for CVS Caremark. So he'll be working directly with myself and the benefits team whenever we have employee questions or anything we might need assistance with. So Chris has put together a presentation here, so I'm going to turn it over to you.
Awesome. Well, thank you, Jennifer, and good afternoon, everyone. As Jennifer noted, my name is Chris Anderson. I am the account executive with CVS Caremark, responsible for the overall relationship between our organization and you folks, making sure that we meet your expectations and obviously answer any questions that may arise. As Jennifer noted, we'll have a Q&A at the end, and I'll just say, I have some stuff here with regards to information, etc. But this is your meeting, so please feel free if I don't answer a question. Certainly let me know if you're not comfortable asking. Certainly reach out to the benefits folks, and they could circulate that back to me as well. But let's, towards the end, if we need to make this more interactive, we certainly can. But I'm gonna walk through kind of who we are, what we do, what your benefits, how they'll be not much different than they currently are, but just want to make sure that some nuances that you are aware of. And like I said, at the end, we'll have a dialogue if needed. So that being said, we are will be your pharmacy benefit manager, or PBM, effective 1/1 of 2025. So basically, think of us as your insurance plan for all things prescription drug related. The first most important thing I want to mention is, just because it says CVS in our name does not mean that you have to go to a CVS location and or mail order to utilize and get your prescriptions. You have access to our national network, which is made up of about 66,000 in-network pharmacies across the country. Being similar to like Walgreens, the Rite Aids of the world, supermarket chains like Kroger, HEB, Costco, so you name it, and more than likely they are in our network. In addition to some of those major chains, we do contract directly with a lot of the independent pharmacies as well. And we'll get into some of the specifics in a minute, but just always make sure that that network is in network with us by going online when you do that. In our network, in your current network, there's a pretty significant, if not 100% overlap between pharmacies that were being used, and all that was done before the business was moved over. So if any impact was done from a network perspective, you would have been notified previously. So that being said, I'll move on to the next slide here. So we talked a little bit about, I touched briefly about online. So a couple things. The website, caremark.com, is currently live for individuals. So you currently have the ability to go out there and register. We had what was called early offerings available and turned on for you guys. So you can go out, look at your benefits, look at the formulary, look at the drugs that are covered, look what options are out there. cost of drugs, cheaper alternatives, and things along those lines. I will note that there is likely some drug disruption, positive, negative, indifferent, that likely happened for some individuals. And you would have been lettered, those individuals, within the past month or so, to give you ample time to work with your physician, et cetera, to look at an alternative medication or prescription and get that in time and ready to go post 1/1 of 2025. So again, on caremark.com, you do have the ability to go out there and register now. We do have your eligibility file already in-house here. You can look at your plan, as I mentioned, check the medication, look at the formularies, order, mail, and service refills. Again, that's after the first of the year. You have access to your ID card, and looking at where you are in terms of your accumulations, or what we call deductibles and out-of-pockets. There are certain avenues, certain prescriptions, specifically specialty medications, which are your more costly drugs for folks that are managing likely a chronic condition. We have the ability to text with you, et cetera. So it's done securely, but it's there to act as another resource to ask any questions and for us to follow up with you to ensure that if you're having any side effects or are new to a therapy, for example, that we address those as quickly as possible. Again, your ID cards are accessible there. And it brings me to a great point where on 1/1, you'll have a new ID card, whether it's digital or the hard copy, which everyone will get a hard copy as well. When you go to the pharmacy to pick up your prescription after 1/1 of 25, please ensure that the individual or the pharmacist at the pharmacy tech, whomever is doing your transaction, has your latest and greatest benefits information on file, i.e. your latest ID card. And I say that because 98% of the issues that we have after a go live date relates to folks not presenting that new ID card and then being told, "Oh, you're not covered anymore," because under your old plan you are not covered. So just if I could say one thing, that's probably the most important thing, is just ensure that your pharmacy has the latest and greatest information from your ID card when you go to pick up that script post 1/1. Obviously, I always like to say there's an app for everything. We do have an app out there as well. As noted, you can currently go out there, download, enroll, etc. Gives you the opportunity to have the same features that I mentioned previously on the regular website. Just in the palm of your hand and on your phone. Like I said, everyone has an app these days, and we're no different. The one thing I will state, and it's not officially, there's no official launch date yet, is we're working on revamping our app to make it a smoother consumer experience. This is the Caremark app is a little bit different than the CVS app. We're looking to integrate all of that into one. The CVS app is more retail facing in terms of ordering products online, picking them up at your local retail location for CVS, etc. So I just want to call that out, that at some point we anticipate in 2025 an updated app that will consolidate all of that information. But we'll obviously work with the benefits folks and share any necessary communication when that becomes available. So I just wanted to call that out. Should there be any questions or concerns when you're looking at the apps? One item more specific, this is for the high deductible health plan, or HDHP, is what's called an HSA, or Health Savings Account Preventive Drug List. This gives individuals that are enrolled in this plan the ability to obtain certain medications, things along the lines like diabetic medications, not all, but some diabetic medications, blood pressure medications, cholesterol medications, etc. If they are on the preventive drug list, and you're on the high deductible health plan, those drugs will bypass the deductible phase. So you do not have to meet your deductible before those drugs are covered. So they would bypass, if they're on this list, the deductible, and the individual would pay $0. So I just wanted to call that out just in case you're enrolled there. I believe I don't know, I'm not sure, but you may have had a similar coverage previously. But again, that will continue going forward as well. And a list of what types of drugs that I was just referring to is noted here as well. And that list, just as an FYI, is updated on a monthly basis. So Jennifer and team, just to ensure that you continue to have the latest and greatest on or around the first of every month, we'll make sure that that latest drug list goes out to you as well. All right. One unique item here, and this is just more of an FYI, as we're kind of in December currently, but we do have the ability to offer flu shots in our national network, not just at CVS, but you do have the ability to go in there and get a flu shot at no cost to you. I say this, it's kind of like, well, I could do that too right now, but the differentiator here is presenting your pharmacy ID card at the point of vaccination. It's a little bit cheaper than going through your medical provider. And again, this is not just with the CVS, but through our network services as well. So there's flu, there's pneumonia, RSV, and things along those lines. So it's not just flu. So that ability to achieve or receive, I should say, a vaccination at an in-network pharmacy exists come 1/1 of 2025. And just ensure that and make sure that you do present your pharmacy ID card when that vaccination occurs. And then the other big ticket item coming February 1st of 2025 is a program called Prudent RX. Now, this will only affect a small population of individuals within the Larimer County benefit plan. But what this is a copay card assistance program where individuals that are taking a specialty drug, and I noted this before, it's usually a high cost medication. Think of like your Dupixents of the world, for example. There's hemophilia drugs, there's cystic fibrosis drugs, cancer drugs, etc. Folks that do or do currently take that drug or will be new to therapy with one of those types of drugs potentially have the ability to obtain those drugs at $0 or zero cost share to them if they enroll in Prudent RX. So I note this because if you are impacted, leading up to February 1st, you will likely receive a phone call from Prudent RX asking you to enroll in the program. You will receive mailings notifying you as well that you are eligible for this program. So we strongly encourage folks to take that call or call them back. And we track the enrollment, et cetera, for those that do participate, not at an individual level, but just those that do participate. So we'll see a number of how many folks do enroll. But at the end of the day, it's a win-win for both Larimer County as a whole, saving them money on these drugs, as well as you as an individual saving dollars on these drugs as well, not having to pay a copay. The one caveat I will say there is that the high deductible health plan, you do have to meet your deductible first before individuals will obtain those will obtain those drugs at $0. So again, if this does apply to you, expect a phone call, enrollment, some print materials, etc. And if for whatever reason you do not enroll, but you do need that script, again, at the point of adjudication, we attempt to make another outreach call. Typically, these drugs need to be signed for and or someone present to receive, or delivery instructions and things before we actually ship them out. And that's just another touch point for us to make sure that we get you enrolled and that you're receiving this benefit when it becomes effective on February 1st. All right. So that being said, that's kind of a short overview that I mentioned. I have a couple additional slides here. It's just some, and I'm not going to go through every single one of these, just some terms that you might be familiar with: deductibles, coinsurance, maximum out of pockets, things along those lines. But I will pause. And Jennifer, if there's anything specific front of mind for you before we kind of open it up, or anything that I may have missed. Again, it's your guys' meeting, so I just want to have the opportunity to have a dialogue and answer any questions that I can.
Sure. So first off, I'll just say that we will continue to have one combined ID card for medical and pharmacy benefits. So that will be hopefully coming in the mail from Meritain here in the next couple of weeks. We're reviewing the final file for approval, and we'll have that done by tomorrow. So you'll get new ID cards from Meritain. Everyone will who's enrolled in medical. And it'll have your new CVS prescription benefit information on there. Now, if for whatever reason you haven't gotten your ID card yet and you need to go to the pharmacy anytime in January or go to the doctor, please contact the benefits team, because we'll have access to, at a minimum, the electronic copies of those. So we can send that to you so you can go on with the care that you need or get your prescription filled as needed. So I wanted to make sure to note that. I know Chris mentioned the prescription drug list for preventive medications. So if that's something you would like to review ahead of time, we're happy to send you a copy of that now. The benefits team does have that. And then once we are live with CVS January 1st, we'll have that information just on our public benefits page on larimer.gov, where you can easily access it. Rachel, were there any thoughts that you had that came to mind?
No. No. I think, Chris, did you mention the 1-800 number that's available as well? It's also on our website.
Yeah, I did not mention it. I don't have it in this deck. But there, and honestly, you put me on the spot. I don't know what it is off the top of my head. But there is a dedicated 1-800 number for customer care that individuals. I'll see if I can find it as we kind of go through here, and I can post that as well. But it will be on the ID cards, I believe, as well.
Yeah, it's on our benefits site as well. And okay. We do have a question. How do we request this list? So the $0 drug list, I believe, is what Andrea is referring to.
Yes. So we can send that to you, Andrea, after our call or webinar here today. Yep. Perfect. Yep. So we will send that right over to you. And we did have a similar program with OptumRx. Chris, I know you had alluded to that. So we had the $0 preventive medication list this year, and we'll continue to have that next year. So we're glad that we're able to continue to offer that. All right. I see another question. So this is from Jackie. So have the new cards been sent out yet? And the answer is no, Jackie, they have not. So we are in the process of, the benefits team are in the process of reviewing each individual ID card right now to ensure that the information on those is correct. We plan to have that finalized and approved by tomorrow, so that Meritain will have the green light to get those mailed out next week. So be on the lookout for those. And as I mentioned, if we're bumping up right at the end of the year or the 1st of January and you still don't have your ID card yet, just reach out to the benefits team, because we will have the electronic copy that we can send you if needed. Great questions. Continue to type your questions in the chat. So the question is, are the drugs listed on the preventive drug list covered for free under the PPO plans? And so the answer is yes. That applies to all 3 of our medical plans. So the standard, the choice PPO plans, as well as the high deductible health plan. These are great questions, you guys. So we'll sit tight here for a couple more minutes. If you have any additional questions that you want to drop in the chat. If you don't have any additional questions, that's quite all right. So we do have a question for you, Chris. So the question is, how do we transfer our scripts over to the new vendor? So do you want to talk about that process in terms of?
Yeah, I mean, if it's not necessarily the script itself that needs to transfer over, as long as the script for example, is currently at an in-network pharmacy, you should be okay. There are prior authorizations on certain drugs. All that has already been sent and addressed and kind of transferred over as well. So only when those PAs or prior authorizations expire will you need to kind of work with your provider. And it's more so on the provider side than it is an individual or an individual member. The providers will get notified that the PA prior authorization expires and they'll begin that process. But if currently, I would be hypothetical, if you're currently receiving your scripts at a script at a Walgreens and you have like 4 fills still left, really nothing needs to be done. Walgreens is a network and you can continue your fills. Just use that ID card that I mentioned earlier on to make sure that they have the latest and greatest so that your claim pays properly. Hopefully that answers it. If not, certainly let me know.
All right, we'll give folks just another couple of minutes here to type their questions into the chat or the Q&A. So it says, I have a script with OptumRx. How do I make sure I will get my next refill? Whomever typed this in, if you can clarify, is that a mail order prescription? Yep, mail order. Yep. So Chris, can you talk about transitions for folks who are doing mail order?
Yeah, so we we received a file from your previous vendor. So those scripts should be transferred behind the scenes automatically. And if you want to work with Jennifer directly, and then she can reach out to me just to ensure that we have all that necessary information on hand for you, we can certainly do that as well, so that there is no disruption, for lack of a better term.
Great. Thank you for that. All right, so let me see. We got another great question here. We had an employee ask, can you clarify how I can check to see if there will be a drug disruption?
So you could currently go out and register on caremark.com with the necessary information. And then that'll link you to the Larimer County specific benefits. And you'll be able to understand the formulary from that perspective, where you can just type in the drug and it'll say covered or not covered. Also, if you were on a drug that was covered previously by OptumRx and will not be covered on our formulary come 1/1/2025, you should have received a letter within the past month and a half notifying you of that change and giving you a list of alternatives. So if you did not receive that letter, then chances are your prescription is still covered under our formulary. And then if you did receive that letter and need to make the change, then please work with your provider prior to your next fill, post 1/1/2025, to ensure no disruption in your therapy, as well as to make sure you obtain the proper medication.
Yep. And I'll add to that, Chris. So the benefits team, as a follow-up to that, we emailed everyone yesterday if you are going to have any sort of potential negative disruption, meaning a medication you're taking now would be excluded next year, or a medication you're taking now will go from the tier 2 copay to the tier 3 copay. So if you did not get notification from us yesterday, and that came from the HR benefits inbox email address, then more than likely you're good to go. But yes, if you just started a medication, because this would have been based on the most recent 12 months. So if it's just something you just started and you want to make sure, you can either call the CVS customer service line. Rachel was kind enough to drop that in the team chat. or you can certainly look that up on the Caremark website, or you can reach out to the benefits team and we're happy to check that as well. So another question we had was, will our current medications automatically populate in Caremark somewhere? So Chris, can you address that?
Yeah, when you say, I'm assuming your prescriptions would transfer over to us. So from the previous vendor to us for 1/1.
Yes.
So
confirmed,
that should, yeah. So that all that should be A-okay. I'm just making sure I'm addressing this properly. There's a couple of different nuances, but the question is pretty straightforward. So if you're currently on a script and then you still have refills available and the pharmacy that is currently receiving it is in our network, then yes, those will transfer automatically. If you are working through mail, as we just talked about a little while ago, you would be transferring that over to CVS mail, and that should be working automatically behind the scenes as well, based on the information that we had previously received from OptumRx. If that is, if there's anything more specific on that, then like I think I said for the other individual, if you need me to check, you can work with the HR team and they could circle back with me, and we could just verify that to make sure and give you peace of mind if needed.
And Chris, does that happen on 1125?
So it would. So yes and no. Yes, it's going to happen on 1125. No, because it's already happened on our side. So anyone that was, all the scripts from a mail order perspective would have already been transferred over to us. Anything that's still open, if there's still refills that are out there, et cetera, and you're going to a retail location and that retail location is in network, then there's nothing for anyone to do. The script is still on file at that in-network pharmacy. Just make sure you give them your updated ID card when you go pick up that next script. Hopefully that makes sense, because there's like there's the mail and there's the retail nuance. So I just want to make sure. And if I didn't answer that to your, if you need more detail, certainly please just ask.
Yep. Thank you, Chris.
Sure.
So it looks like they're referring to the Caremark website. So to clarify, they said all of their information is on the Optum website currently, but I don't see anything in my Caremark account, which you wouldn't at this point. I believe that would not occur.
Correct. Yep.
Until 2025.
Yep. Yeah, because nothing has adjudicated, no claims activity or prescriptions have occurred yet prior to 1/1. But like I was saying, if post 1/1, like you won't see the actual script, I think is what I'm trying to say. Just when you go get that your next fill post 1/1, you'll see that claim activity within your account. And then if this is a mail order situation, then like I said, those you won't see the prescription per se, but behind the scenes, we already have that on file based on what Optum had previously sent to us. Hopefully that helps.
Yes. Thank you for the clarification, Chris.
Sure.
So another question we got is, I receive a home infusion of a specialty medication. Do you have a home infusion service? If not, are you able to ship infusion medications directly to the customer if they have a separate home infusion service set up? So this one I'm going to tackle first, and then Chris, you can tack onto this.
Sure.
So we partner with a local group here in Fort Collins called Origin Healthcare, and they have the ability to provide home infusions for medications. So CVS does not have their own separate home infusion service. We would recommend you work with this Origin Healthcare. And because this is an anonymous person, if you just want to reach out to me directly, I'm happy to provide you their contact information if you're not working with them already, because they're actually free to use if you're on the standard or choice PPO plans. And so in terms of specialty infusion medications, that question I'll toss over to you, Chris, if that's something you're able to ship directly to the customer, or
Yeah,
if that needs to go to the provider.
I would, and I don't need this individual to share it here.
Yeah.
But I would ask in the situation to let you let you know if they're comfortable with it, what that medication is, because where I'm going with this is sometimes on our side, some of these home infused medications come through the medical benefit, and some may come through us where we have the ability to send it to a provider. So depending on which one it is, I want to make sure I give the right answer, given the sensitivity. So I don't want to misguide anyone, and just want to really make sure I provide the proper answer here.
Great. Thank you, Chris.
Sure.
Next question. What's the process from changing from local pickup to mail order?
Okay. I got that one. So for mail order, you actually bring up, this is actually a good point because I didn't bring this up during my presentation. So local pickup, there's a retail 90 component. So that means that you have the ability to obtain a 90-day supply at retail. You could also get a 90-day supply via mail. And that's the important piece to know. Mail is, unless it's specialty, mail is only available in 90-day supplies for certain drugs, maintenance medications specifically. So if you're currently on a 30-day supply and then you want to transition over to mail, then your prescriber or provider or doctor would write a 90-day prescription and send it over to CVS mail order for us to fill that. If you currently have a 90-day retail prescription, then you could work with customer service to transfer that over to CVS mail, or you will be able to facilitate that online through caremark.com to make that transition over. So again, think about it. If you're currently on 30 days, you got to move to 90, you will need a new script from your doctor writing out that 90-day script. If it's 90 to 90, no new script is needed, just some operational items like shifting it from the current mail order or current retail facility to our mail order through the app, mobile, or through the telephonic line that I just noted before.
Yeah, it certainly is convenient to have the option to have your medication delivered at home these days, and it's great that we offer that. As a reminder for Larimer County plan members, if you do mail order and you're on the standard or choice PPO plans, you only pay for 2 copays worth, even though you're getting 3 months worth of prescription benefits. So you actually save 1 month's copay by doing that, or if you do the 90-day fill at retail. So it's definitely a good option to look into and save yourself a little bit of money and time once you have that set up and rolling.
Yeah, that was the second part. You stole my thunder, Jennifer. But that's what I was going to say too, is you're getting 3 for the price of 2. So, and then I know from a 90-day perspective, if you're in a high deductible health plan as well, there is even though likely you're going to be in the deductible phase, but there's financial incentives is the wrong word, but the pricing is aligned to make it more advantageous for a member. Rather than picking up 3 30-day scripts through the HHP, picking up 190 would be advantageous as well, based on the pricing setup behind the scenes.
Excellent. All right, well, we'll sit tight here for another couple minutes. If folks want to type in any other questions, these have all been really helpful. No question is a bad question.
And as we kind of pause here, Jennifer, I'll get this presentation over to you so you could have it as well. The funny story is my PDF stopped working this morning for some odd reason. So I'm not able to convert it yet, but once I do, I'll send it your way.
No worries. That would be great. Thank you.
And then the one other thing, Jennifer, I will say too, this is more just a dialogue just with you. But if anyone, comes to you with any specific drug related questions, if you want to just talk to me live, rather than send stuff via email, please do that as well. Just want to give that as an option.
Yes, absolutely. That's always my preference. So thank you. Okay, I am not seeing any other questions come up in the chat or the Q&A. Rachel, anything else you wanted to add or share before we end our meeting?
Just thanks for attending. We're happy and excited for this change. Hope everyone is too. And anything that you guys run into, know we're here to help. And Chris is just a phone call away. So we can get him involved right. as well if something should come up. So these things happen with these implementations. So don't worry about it. We'll get it fixed and fixed quickly. Just reach out.
Yeah, and that's a great point. I wanted to mention before we kind of wrap up here too, in terms of 1/1 and after, pharmacy benefits really hit folks a lot sooner than medical. So like, there's going to be people that are going out on January 1st to pick up a claim. And if there are any issues or anything like that, we as an organization have literally a room full of people to address and tackle these types of one-off situations to get them addressed as quickly as possible. So again, if there happens to be any issues or if it's benefits related questions, etc., just let us know. Like I said, for 2 weeks post 1/1, we have, we'll call it a war room for lack of a better term, of just folks sitting in a room and working through anything operationally that needs to be addressed. Happy to say that those 2 weeks are now slowly decreasing because of operational efficiencies. But again, more so for you, Rachel, and for you, Jennifer, too. That it's really all hands on deck for the first 2 weeks of January.
Yep, it really is. And we'll be here as well, so, our team is always on standby. Even January 1st, I'm on standby in case, something urgent does arise. So we are here to support you fully any way we can. So please do not hesitate to contact the benefits team if you need help. Chris, I want to thank you for your time and your presentation today. And Rachel, thank you for your input as well. I want to thank all of our participants who joined and the great questions that you asked us here today. If you think of questions after this, please reach out to us. You can either reach out to Rachel or myself directly, or feel free to email the benefits team at our general inbox. And as a reminder, everyone who attended today's webinar will receive 20 Nectar points as well, just as a little thank you. So again, appreciate everyone's time. Hope you have a great rest of your week, and we will adjourn. Thanks, everyone. Bye-bye.
Thank you. Bye-bye.
Thank you.